Well, thank you for staying tuned for another segment. And joining us is re-elected State Senator John Keenan. He is our guest for this segment. Senator, thank you for joining us.
Thank you for having me. It's great to see you.
Here we are. I know I recently had a chance to talk with you, but you have been re-elected to another term. The folks in your district wanted to have you stay at the State House and keep doing what you're doing. Kind of talk to me about that.
It was great, and I truly appreciate the support that I received throughout the district. I'm very fortunate to represent a great set of communities in Quincy, Braintree, Abington, Rockland, and Holbrook. They're very active. They're very engaged. They make sure that I stay engaged, which I appreciate, and to get their support and to be reelected again. It's very humbling and it's an honor. And I look forward to working with all the select boards and the city council and my colleagues in the House of Representatives as we continue our work over the next legislative session. It's going to be challenging, but certainly exciting.
How has COVID-19 been a challenge for this time around to get reelected?
It just changed the way of campaigning. My campaigns in the past have always been on the ground, out and about, hitting events, knocking on doors, doing all those type of person-to-person things, and being where people are. And this turned it all upside down. So we did more on social media than what we've done in the past. Tried to get to as many meetings virtually as possible. I'm not a big fundraiser, so being able to campaign with mailings is something that I generally don't do because I don't raise a lot of funds. So it was quite different, and social media played an important role, and a lot of phone calling with people. And then when I was out and about, the handshake or the hello was distant, and it really changed the dynamic. Politics is such a people business, and that was different this time around, no doubt.
Staying on the subject of COVID-19, over the past few weeks, we've seen a steady uptick in COVID cases. We see the governor do his daily press briefings, and recently he has made an announcement that we're rolling back to phase 3, step 1, which means that you're going to see a reduction when it comes to certain businesses and stuff like that. What are you aware of in regards of these different changes? What are your thoughts?
There's a lot of concern out there, particularly among small businesses, of how they're going to further adapt and whether they will survive these changes. The state has put some programs in place, some grant programs in place to help small businesses. There's money available for those that have 50 employees or less, or 5 employees or less. So there's a lot of different programs out there, but it's going to be really challenging for those small businesses. And we're starting to hear that again. We heard it in volume in the spring. The summer things seem to improve, and now here we are again. The numbers are alarming, and we're at the stage now where the call has been put out by the Commonwealth to retired healthcare providers to come back and consider working at a field hospital in Worcester. So the concern is not only spread of the virus, people getting sick, but people getting hospitalized and us not being able to handle the hospitalizations in particular.
I know I'm not sure as to what happened in your office as of March and April and through the summer, but many of your colleagues that I've talked to in the Senate and the House of Representatives kind of indicated like it seemed like they're working around the clock with no end in sight. Now that we're hearing that we could see as many as 300,000 doses of vaccine for COVID, how do you feel in regards to knowing that there is preferably a light at the end of the tunnel?
I think there is a light at the end of the tunnel. Unfortunately, I think it's still a bit of a distant light. We have to not only get the current allotment of doses out there, and the governor set out the plan, yesterday as to how those will be allocated. That's going to take some time. Yeah, I think optimistically, we're looking at perhaps June before there's real community reach with the vaccine. So it's going to take time, and people are suffering in the meantime. So we're trying to address issues such as housing and food security and survival of small businesses. And that work has to continue on. We can't step back and take a breather and say, oh, the end is in sight. It's a bit of a ways off. And what we saw in the spring was just a flood of people calling, looking for assistance. And we're certainly over the last few weeks, we've seen that pick up in terms of people for their unemployment benefits or access to other benefits. You can see it, you can feel it, it's real, and we can't take a step back. We've got to keep making sure that we meet those needs while the process of getting the vaccination out into the community goes forward.
And not to put COVID-19 aside, but we know that the legislative session is almost coming to an end at the end of this month. It'll be in the books and you'll be sworn into a new term. Do you have anything that's kind of hanging in the balance? Anything that might be still in committee? Anything that you've co-sponsored and had a lot of hopes that it would gain traction this time around and be signed into law?
Yeah, there's been some discussion about what may be taken up over the course of the next couple of weeks. When the legislative session was extended, it was extended for basically three purposes: to address the budget situation, COVID, and to allow those matters that were in conference committee, police reform, climate, economic development, to allow those matters to be resolved and presented for final action in the legislature. So while there are some things that I'd like to see go forward, we're really not sure how that's going to transpire. For instance, we've worked hard on a bill to help people with MS, and it's this close, and we'd like to see that one go across the finish line. Presently now, insurance companies have the ability to move people who are stable in their medical condition because of having found the right medication. The insurance companies can ask them or tell them that they have to switch off that medication and go on something else, and that's devastating for people with MS. So we've worked hard on that, and we're this close. So I'd love to see something like that move forward. But the main focus is on finalizing the budget and addressing those matters that are still in conference committee, and then continuing to respond to COVID. But time is going by quickly, and we're coming into the holiday season, and right after that, the session will end and we'll start a new one. So it remains to be seen what we'll be able to accomplish.
And it seems it's kind of awkward because of the situation, because of COVID-19 and its effect. I mean, as you said, working on the budget, I know it was just recently that both legislative branches actually voted on the 2021 budget, and it's going to be, we're coming into a time when right around January is the time when you get to see the governor's budget.
Correct.
So it seems like you're going to be going from one budget cycle right into another.
Yes. So we just completed the budget last week. The governor has it. It's about a $47 billion budget, and it reflects that we had interim budgets for the first 5 to 6 months of the fiscal year. And this will kind of formalize that spending and move us for the next 6 months. But yes, the budget planning process for the next fiscal year, which promises to be very challenging, is underway. We're looking every week and every month at revenue figures to determine what will be that consensus revenue figure upon which our fiscal year 2022 budget will be built. And ordinarily, that process would have been underway for several weeks at this point. And now it's just getting started now. And we anticipate that the governor will file his budget in January, and we'll be going through this all over again, trying to figure out where we're going to be in this COVID environment.
And knowing that the governor's administration that they have to kind of project out revenues, what kind of just in your own opinion, what kind of a task is that going to be, knowing that this year has been atypical of any year that we've ever experienced, and going into next year until we are able to see a vaccine grab hold and kind of reduce COVID to something that can be controlled. Is it going to be? It seems to me like it's going to be virtually impossible to project revenues if we're not sure as to the peaks and valleys of the COVID waves.
That's exactly what the difficulty has been in the current fiscal year. The early on late last spring, we advised all the communities to plan on about a 10% cut in local aid, similar to what was experienced back in 2008 and 2009. Revenues did okay. Some months they beat projections, other months they were right on projections, and overall, in some areas they were down, in some areas of collection. But the revenues did okay. Fortunately, we have a healthy stabilization account, a rainy day account, that we were able to draw almost $3 billion from, which is about half of what was in there. So it was a significant draw. It wasn't quite $3 billion, but a significant draw from the rainy day fund. And so we're going to have to look at all those things going forward. And because we've used one-time revenue from our stabilization account, one-time revenue from the federal government, we have what they call a structural deficit. And we're going to have to fill that as we move forward. And generally that's done from a growth in revenues. But we don't really have a good sense of what's going to happen. The ability of the state to get the vaccine out there, the effectiveness of the vaccine is critical. And ultimately it comes down to how safe people will feel to go back to restaurants where they'll pay sales tax, to go back on the MBTA where they'll pay their fares, and that will help address the $580 million deficit that the MBTA has, how safe they'll feel just going out and about and spending their money. And we just don't know.
Again, if you're just tuning in, we are speaking with State Senator John Keenan. He is our guest for this segment. Knowing that we're seeing the legislative session end, also knowing that we're going to see a transition down in Washington, D.C. Does that play a role here locally in regards to what can be anticipated for any assistance that we can get from the federal government?
It does. It absolutely does, because so much of what we're going to need going forward is going to be reliant on what the federal government does. If the federal government stimulus package contains money for state and local governments in particular, that's going to ease the burden on the state budget and on municipalities. They'll continue to be able to provide the services, keep firefighters, police officers, teachers, librarians, and all those important folks at work delivering those services. And there's a sense that, as we transition, that there's greater prospects that hopefully Congress will work better together with the administration. But we're still facing uncertainty even there. We are in the second week of December, and we're still in a situation where we've got an electoral college results that will be certified by the states soon. We don't know what Congress will do with that. President Trump still hasn't conceded. So, but in the meantime, President-elect Biden is moving forward. So we'll know a lot more come January 20th, I think is inaugural day, as to where we are. And I think if, President-elect Biden is sworn in, that'll bring some certainty, and hopefully we can all move forward and address, the very important issues and address them in unity as a nation.
Looking forward to your new term, your next term in office.
Yes.
And knowing that, the second half of your legislative term was unlike any other that you've had to endure. How do you plan moving forward for 2021?
Well, we're reviewing what legislation we'll file. We're going through that process now. My hope is that we're able to get back into the State House as soon as possible. My method of legislating is to deal directly with my colleagues, to see them in the hallways, to see them in the meeting rooms, to talk with them face to face, to advocate for what my causes are in person. And it's difficult to do that when we're remote. So my hope is that we'll move quickly into that. And then that we'll move forward on some real critical legislation. We've got to make sure that we provide for the cities and towns with local aid. And, I continue to focus on substance use issues and as relates to opioids, and increasingly so with the emergence, unfortunately, of methamphetamine in our region. And then also on issues that address people that have disabilities and all those types of things. So there's a lot to be done, and I'm looking forward to it, but I'm really hoping that we'll be able to get in there and do it in person, and that we'll be able to get out and meet with advocates and citizens, and makes us better legislators when we have that contact.
Knowing that you have been such a champion for the opioid epidemic, for the what we faced prior to the pandemic, Do you feel as though that because of the pandemic that drug addiction and the issues with opioids have fallen by the wayside, and if folks have kind of forgotten that this is still a crisis?
I think it's gone off the radar screen a little bit, and it still is a crisis. The numbers of deaths related to opioid overdoses um, have increased. Number of overdoses have increased. We know that fewer people are accessing treatment because of concerns about COVID, and so we've got to look at doing better reaching people who are in need. There's a lot of people, unfortunately, who are in their homes by themselves using different substances, whether it's alcohol or drugs of different things. And that's just a recipe for overdose and abuse. And we've got to do change how we reach people and make them aware of the programs and the services that are available. And hopefully they'll avail themselves of them. It's a challenge, but we're going to keep pushing forward on it.
Probably the final topic I must chat with you about is the holidays. What goes on in the Keenan household? Are you ready for the holidays? Are you gonna do anything special this year? Or is it difficult because of our circumstances here as a nation?
It's very difficult. I'm one of 7 children. I'm the middle of 7 children. On my side of the family, there are 20 grandchildren, and we get together usually at Thanksgiving and at Christmas. And Thanksgiving we weren't able to do that, and at Christmas we've agreed that we won't do that either. So it's my children, they're grown. My oldest one is 26. He'll actually turn 27 Christmas Eve. My middle one's 25. My youngest is 20. And, they look forward to really getting together with their cousins. They see their cousins all the time, but for whatever reason, Christmas is where they just can't wait. So that's going to be different. But they know that this is something that's going to pass. And, everybody seems to be saying it, but it'll make next year all that more special. So yeah, we're going to miss that contact. We missed it at Thanksgiving, and we're going to miss it at Christmas. But it highlights that it's not about presents or things like that. It has made, I think, a lot of people realize it's who you spend Christmas with that's most important. And we look forward to in the spring, in the summer, and then to the holidays next year of getting back to what's so important, which is family and friends. So it's different, no doubt.
We're about to wrap everything up here. I want to give you an opportunity to either extend well wishes or holiday greetings to not only folks in the district, but the folks who are tuned in, or any information if you have constituents who want to reach out to you in your office.
Sure. First, if anybody wants to reach out, please do so. I'm very fortunate. I have an incredible team that have done incredible work over the last, all the time, but particularly so over the last several months. So the office telephone number is 617-722-1494. And then you can email me at john.keenan@masenate.gov. And we will get back to you and provide whatever assistance that we can. And I wish for everybody who's out there, who's struggling, and I think everybody's struggling in some way because we don't have that family contact and that friend contact. But anybody, I wish everybody really a healthy and happy holiday season, a Merry Christmas, and I hope the new year brings everybody health and happiness as well. And in the broader sense, I hope it brings us peace across the world. And that's my wish, and I share that with the people I represent, and I thank them for the honor of serving the state Senate. And we're all going to get through this. We'll come out better on the other side, and I'm always optimistic, and we'll bring the holiday hope and cheer into the new year and make it the best year we've ever had.
Senator, I want to thank you, and I want to thank your staff for making this possible, and look forward to more segments with you. And again, wish you and your staff a Merry Christmas, Happy Holidays, and a Happy New Year. And
Yes.
Look forward to us getting together more in 2021.
Kevin, thank you, and the very best to you and to yours. Enjoy. Thank you.